And this is very simple. This is breast cancer assessment, and we give this to women so that women can find out their pathway. Now, if you're a breast cancer specialist, you don't need this. If you drive from Oxford to Banbury every day, you don't need the map of Oxford to Banbury. But if you're driving to Exeter for the first time, or you haven't driven to Exeter for some time, or if there might be roadworks or something new has happened, you need a map. This is called the Map of Medicine. This is software that was developed, and I was involved in its from its earliest days in funding it, because it just seemed to me this is something very powerful. And you can start to put in here, there's links in here to Cochrane reviews. And you can start to put in things here like telephone numbers of clinics and a whole variety of local stuff. But it's technology, it's very simple sort of thing. Now, I mentioned networking. And you see, the 20th century was the century of the bureaucracy and the hierarchy. The 21st century is the century of the network. And this is a nice, this is a very important book actually, Clayton Christensen's book. And he's written mostly about engineering and the Innovator's Dilemma, which you may know. The subtitle of the Innovator's Dilemma is When New Technologies Cause Great Companies to Fail. For example, DEC said, oh, personal computers are a sort of passing fad, doesn't exist anymore. When hydraulic pumps come in, a number of earth digging companies said, well, hydraulics, what's that, you know? We'll use them to drive the wires a bit faster. Don't exist anymore. Now, he's written this very interesting book with two doctors called The Innovator's Prescription. And networks, it's people working together who trust one another. And of course, with the internet, that has really made it much easier to work in networks. But networks exist long before the internet, and we need to think of ways in which we use networking. You see, it offers an alternative to either markets or hierarchies. Transactions are coordinated and controlled on a mutually agreed basis. This is a very good definition. This is one of the classic books on organization. We can give you all these references and things. So, in the 20th century, we did this, and the 21st century, we've moved to this. It's not hub and spoke. We're not letting the teaching hospital say, well, we're the centre. I think now, actually, I've said this to Paul, that if I were I was in the position I was in many years ago with the evidence-based medicine, I would not have called it the Centre for Evidence-Based Medicine. I'd have called it the Evidence-Based Medicine Programme at Oxford. It's just at Oxford. So it could be at Barcelona, or it could be, for Spain, or it could be, it's the language very important. Neither is it a market, nor is it one blob taking over the others. You see, you have to have hierarchies, bureaucracies to manage money and employ people. But hierarchies can't solve complex problems. Only this can solve complex problems. Supposing, I was discussing today, let's say epilepsy in London. My guess is we spend about £250 million on epilepsy in London. No one's got any idea what's happening. So how would you make epilepsy care better? One way is to say, well, we'll get the chief executives and they'll tell the people under them and they'll tell them. It doesn't work. Too complicated, too complex. These are what's called complex adaptive systems. So what you want to do is get all the people with epilepsy and their parents, and people like teachers of learning disabled children together, because half of learning disabled children have epilepsy, and you get neurologists and GPs, and you say, okay, let's spend a day just talking about epilepsy and what are the problems and what we're going to do about it, and solutions will emerge. Not through command and control, but through networks. And you see, these people, someone said to me, well, what do you need to create a network for rheumatoid arthritis in London and the north of London? I said, you need to have a professor of neurology who believes that he or she is no more important than a pharmacist in Welwyn Garden City, or a GP in Camden, or a patient in Islington? See, if the patient doesn't take the medicine, the patient is at least as important as the professor. It's just a different type of importance. And this is revolutionary stuff, of course. Networks are revolutionary. It's different from that. And just this issue of creativity, this is a very, very good book called The Knowledge Creating Company that I think, particularly the engineers, if you're going into innovation, it's how the Japanese industry creates new things. It creates networks cutting across organizations. It's got a very firm bureaucracy, but it creates these networks. That's how the bread making machine was developed, or the Prius, or the Lexus. You know, these are, you can encourage creativity by bringing together these networks. You make them what they call hypertext organizations. Okay, now the third thing, the patient, the citizen. Now imagine I've got familial hypercholesterolemia. This is the way it will be. I get reminders by my phone. Why is it someone said that my hairdresser can send me reminders but not the NHS? Very good question. And then the lab result comes to me. I managed to slip this into our recent review. And so the lab result comes to me, something like this. And here's an example of what the lab result will look like. And it says cholesterol unchanged. It says, look, this last test was only done 12 months ago. If you or your doctor send another test, we're going to chuck it out. And it says here, you see, the first test is increase the amount you walk. Try to walk an extra 30 minutes a day. To find a big dog, click here. And you see, the lab's got my postcode. The lab's got Google. And this is in Abingdon. That's in Abingdon. That's 6 miles from here. Very simple, isn't it? Does it happen? Not at all. You see, 150 million lab reports are sent out, usually on paper or electronically, to GPs. So then I've got to drive to the health centre or take a morning off work or phone up or something. Of course, it's interesting with doctors. Many doctors immediately say, well, I can think of a patient who doesn't want it that way. Okay, well, I can think of 30 million who do. So let's start with the 30 million who do, another 20 million, then you'll have to phone them up or write them or do something. But that would probably save, 30 million visits to the doctor every year. 600 million prescriptions, same thing. Now here's patients. This is something I helped a young doctor start, which has proved very interesting, very controversial. I want great care. And it's very simple. It's providing ratings on feedback on services. And we started off with giving ratings on doctors, which the BMA didn't like, but everything's rated these days. There's an article in the Atlantic Monthly, if it moves, rate it. In America, kids are rating their school teacher and the university. Like some of you may be rating me at the moment, are you? But increasingly, we're turning this into what's called co-production. That if patients are having their time wasted, surely professionals are wasting their time. My wife went to pick up someone from hospital. It took her about 4 hours to take him home and get a prescription. Well, it wasn't only her time was being wasted, but most of the clinicians say, oh, well, it's always like this, no, we can't do it that way. She said, well, why can't you write a prescription? Oh, it's not possible, So the idea, I've now started to think a lot more about citizens. A good experience for patients is not only an end, it's a means. It's crowdsourcing is the jargon. One of the very clever young people who I work with in this, he said to me, oh, crowdsourcing, that's a very 2009 concept. What's that thing? Incentive, is it the innovation website? Innovation competitions and getting these sort of things, people putting problems up on the web for other people to solve, either with rewards or without rewards. There's a lot of brain power out there doing these sort of things. And of course, Amanda's Think Well idea is very similar. Okay, the last thing, effectiveness and cost effectiveness are 20th century concepts which are equally valid. But in the 21st century, we need to think of values. And this is my very simple model, which stood quite well over 10 years when speaking to clinicians, for example. There's the evidence, the clinical condition of this patient, and the values of this patient. And this is what Peter Rothwell calls personalized medicine here. How do you relate that? And decision support, of course, tries to do this. Not very well, but increasingly we'll see decision support systems trying to relate the evidence to my particular clinical situation. So that's a computerized decision support system. And then when we think of populations, it's a similar model. So the evidence about breast cancer screening is the same in Hong Kong as in England. But because breast cancer is much less common in Hong Kong, they decided not to implement breast cancer screening. I think they have now because of a value decision. And it's very important to remember that politicians can make any decision they want. Values trump evidence in a democracy. You as officials, as you will be, namely people paid to give advice, you've got to live with that. And you have to know what your point of resignation is. But the minister, when I dealt with screening, if the minister wanted to introduce prostate cancer screening against my advice was don't do it, but politicians, if they felt, well, men are very concerned about this and they feel it makes it less anxious, and they meet lots of men who've had a PSA test and are still alive, therefore it must work, and I haven't persuaded them, then it's values trump evidence. You just have to decide whether you can live with it or not. Values trump evidence. The very good writing about this is a book by Mark Moore called Creating Public Value, not about healthcare, about how we do these things. And finally, just this is the charity I run called the Campaign for Greener Healthcare, and I'm hoping that many of you will come and work with me. Certainly, I'd love to see the engineers and talk about the sort of problems we're facing. But these problems are going to be, we finished with just to say a word about sustainability, because climate change is the major challenge that health faces in the 21st century. And sustainable healthcare equals sustainable estates and facilities plus sustainable clinical practice. And clinical practice in the 21st century will have 4 features. Every clinician will be involved in prevention, because prevention is the best thing to do for reducing the carbon footprint of healthcare. Secondly, patient-centered care. Put the patient at the centre of everything, not for moral reasons, but for practical reasons. Thirdly, lean pathways. There are millions of follow-up visits for which there's no evidence, so let's rip those out, reduce the pathway. And fourthly, advancing one of low-carbon treatment options, online psychotherapy as opposed to drugs. So we'll see health technology in future. We'll have to assess the carbon footprint of technology as well as the financial cost, and I'd be interested to discuss that with you guys as you're starting to think about both the direct carbon costs of what you're designing and the indirect carbon costs or the indirect carbon savings of the number of visits reduced. My friend's the Director of Public Health in North Yorkshire, which is a very big patch of England, and the NHS staff, never mind the patients, drove 16 million miles last year in 1 out of 152 primary care trusts. That's a lot of carbon. So we have to find solutions to that. So that's the future. These are the 4 principles about knowledge. There's lots of other things to think about. For example, how do you develop payment systems that encourage good behaviour? Because the payment system we've got at the moment encourages bad behaviour, namely more hospital admissions. And these are 4 ideas for managing knowledge. I'd like you to turn to your neighbour. Remember, I've only spoken about a part of the future, primarily concerned with knowledge and sustainability. I'd like you to reflect on what I've been saying and come up with other ideas about how the 21st century healthcare will be different from 20th century, and we'll take some feedback. Okay, so 2 minutes to discuss this with someone else, and then we'll have 10 minutes to take feedback. Okay, starting now. Can you put the lights up, please?